Hello, my name is Freya Barber, and I'm here to talk about the creation of antiseptic surgery. Uh, Before the creation of anesthesia, surgeons were valued by how quickly they could successfully perform their procedures. They had to be fast because patients were awake, scared, usually fighting back, and were at great risk of bleeding out or dying from shock. It became more deadly because the patient um, was not awake anymore, so the surgeons were much more willing to go do deeper, more complex surgeries. In addition, the operating room became a bit of a conveyor belt where the surgeons' tables and tools, hands, garments were not washed between patients. So, this all led to a spike in postoperative deaths due to infections. And we have this quote from Sir James Young, who was a surgeon during the 1860s. A man laid on the operating table in one of our surgical hospitals is exposed to more chance of death than was the English soldier on the field of Waterloo. Uh, During this time, a man named Joseph Lister began his study of medicine. Uh, while he was studying medicine at the University College of London, he spent time as a wound dresser and became a house surgeon under his professor. Um, During his time as a wound dresser, he took note of the various levels of decaying flesh, pus, and other symptoms of infections in various patients. After graduation, he began to focus on finding a way to reduce the rates of sepsis in hospital settings. During this time, infection was believed to come from miasmas that arose from the wound and would mix with the air. Lester noted that once cleaned, some of the wounds healed. This led him to suspect that the cause of infection was something in the wound that could actually be removed, and not just like a natural part of the healing process, which was the original assumption. Eventually, Lister was introduced to the work of a French scientist um, named Louis Pasteur. I'm sorry, I don't know how to say the name. Um, Pasteur had proven that liquids like milk had lower rates of fermentation and spoilage if they were protected from the air. This led him to believe that this putrefaction was due to airborne microorganisms and not spontaneous generation, which was the previously accepted explanation for this sort of thing. Lister had also observed that there was a difference in morbidity between cases of simple and compound fractures, the main difference between the two being whether or not bone pokes through the skin. Lister began working on developing a way to prevent germs from entering wounds by using a chemical barrier called an antiseptic. Uh, The results of his experiments were overwhelmingly positive, although it did take time for the community to accept that there were little invisible germs in the air causing infections. Um, Over the course of his professional career, he started to encourage his fellow surgeons to take more steps in sanitation. He also invented a few different tools to help aid in the sterilization of the environment. So the new standard that he introduced was that all of the tools, gloves, hands, workstations, patients, wounds, cloths, like everything in the immediate vicinity of the patient was to be cleaned in the carbolic acid solution. In addition, he also had this uh, hand pump, and later he created, they called it a donkey. I don't know why they called it that, but it would spray, it was usually sprayed by an assistant in the air to kill the airborne germs to try to prevent uh, infection that way. Another thing he introduced was he also started to advise that other surgeons don't use any tools that have kind of a porous material. He found that it was easier to clean just pure steel instruments. So, for being the person that introduced, or like really popularized antisepsis being or popularized trying to remove germs from the environment. It was a bit strange that he was against asepsis. The difference between the two being antisepsis is the cleaning of the tools in the immediate surroundings of the patient to prevent infection. Asepsis is to just create a completely sterile environment in order to cleaning everything to prevent infection. He thought that it was impossible to remove all germs. He also thought it was a bit unnecessary. He thought that as long as the germs weren't in the immediate vicinity of the patient, that it would be fine. Um, he also figured that people would always prefer that the surgery took place in their home and not at hospitals, which were commonly meant for poor individuals back during this time. When you were admitted to a hospital, you had to put down a down payment for a funeral because they were so dirty and not well maintained. It was expected that you wouldn't be making it out. In conclusion, the invention of antiseptic surgery opened the gate for the aseptic technique we use today. Without these information, more complex surgeries would be a death sentence, even if you did make it off the table alive. It also changed where medicine was performed. It moved treatment out of the home and into a controlled environment, albeit eventually. Um, these are my sources. I would strongly recommend the butchering art. Uh, it's a really interesting book, and the author does a really good job making it all extra fun and uh, kind of just adds a bit of life to the overall story. I enjoyed it a lot. So, uh, thank you for watching.